A report released by the Minnesota Department of Health finds that students in schools serving mostly lower-income families are more likely to have cavities and tooth decay.
It is due in large part to poor access to cavity-preventing dental sealants. In today's Health Check, Delane Cleveland has more on the importance of dental sealants and what some local dentists are doing to help provide dental access to the families who need it most.
A visit to the dentist isn't generally considered by people as their favorite thing to do. But make no mistake that without proper dental care, problems could arise, especially for children.
Without good preventive efforts, they're going to get decay at an earlier age, and untreated decay can lead to pain, infection, and obviously loss of time from school, difficulty learning.
Unfortunately, Dr. Todd Tsuchiya of Bassett Creek Dental in Golden Valley says there's a disparity in dental health among Minnesota children based on family income.
Dental disease or cavities is the #1 chronic disease in young children.
To help prevent cavities, dentists use dental sealants as part of a total package when treating patients.
And then we just apply the actual sealant, which is a thin resin that fills in the grooves of the tooth.
After shining a bright light on the coating that's painted on the tooth, it hardens in a matter of seconds.
There's little white areas that are filling in the grooves that helps prevent food and bacteria from getting stuck in there, and that's what a sealant is.
It's a simple procedure that's usually done with kids at age 6, but state health officials found that third graders in schools serving mostly higher income families are 1.5 times more likely to have dental sealants than their counterparts in lower income schools.
There are a number of barriers to care that these young children unfortunately find. One would be probably cost.
That's one reason why Bassett Creek Dental takes part in an annual event every February to provide free dental care for those in need. But even the folks here say more needs to be done.
It really requires a statewide and community-wide effort from a number of fronts.
In Golden Valley, Delane Cleveland, 12 News.
Dental professionals say Minnesota ranks dead last in the U.S. in Medicaid funding rates for pediatric dental care. And as a result, a coalition comprised of the Minnesota Dental Association and others are working with the state legislature to improve that reimbursement.